Let's see types of diabetes mellitus. What is diabetes mellitus? It's a group of common endocrine diseases characterized by sustained high blood sugar levels, hyperglycemia. If you are a nurse or nursing student, definitely you have to ask in the patient history, are you diabetic or not? So, all of us must know what are the types of diabetes mellitus. GM can be classified into two. Type 1 DM and Type 2 DM. Type 1 diabetes. This is an autoimmune diseases in which your immune system attacks and destroys insulin-producing cells called beta cells in pancreas. It usually diagnosed in children and young adults, but it can develop at any age. What happens in type 1 diabetes? Here the body doesn't have enough insulin. Before it, just understand, insulin is a key hormone produced in the pancreas that promote transportation of glucose from bloodstream to the body cells, mainly hepatocytes in liver, skeletal muscles, and adipose tissues. In type 1 diabetes, immune system attacks beta cells which producing insulin hormone in pancreas. So lack of insulin causes increased glucose levels in the blood and leads to hyperglycemia. Do you know one of the most important complications of type 1 diabetes is GKA, that is diabetic ketoacidosis. Glucose is the main source of energy. So here, body cannot use glucose for energy because the transportation of glucose from bloodstream to body cells is disturbed due to lack of insulin. So it starts to break down fat instead. This process eventually releases substance called ketones which turn your blood acidic. This condition is called diabetic ketoacidosis, which is a medical emergency. It causes difficult breathing, vomiting, and loss of consciousness. Treatment includes people with type 1 DM need synthetic insulin every day, blood glucose monitor, carbohydrate counting, exercise regularly, and keeping a healthy weight. Next is type 2 diabetic mellitus. This is a most common type of diabetes. It mainly affects adults, but children can have it as well. The main complication of type 2 diabetic mellitus is HHS, that is hyperosmolar hyperglycemic state. It happens when your blood sugar levels are very high, over 600 mg per dl for a long period, leading to severe dehydration and confusion. It requires immediate medical management. Treatment including healthy eating, regular exercise, weight loss, diabetes medications, mainly metformin or insulin therapy, and blood sugar monitoring. Let's see additional classification of DM. The first one is pre-diabetic. This type is the stage before type 2 diabetes. Your blood glucose levels are higher than normal but not enough to be officially diagnosed with a type 2 DM. Next is type 3C diabetes. This is a form of diabetes happens when your pancreas experiences damage other than a autoimmune related damage. We already discussed before, type 1 DM is due to autoimmune diseases, but here in type 3C DM, pancreas do not producing enough insulin because of some other disease conditions like pancreatitis, pancreatic cancer, and cystic fibrosis. Next comes gestational diabetes is a condition in which a person without diabetes develops high blood sugar levels during pregnancy. Gestational DM can go away after pregnancy. However, it can increase the risk of preeclampsia, depression, and of needing a cesarean section. And do you know, if you have gestational diabetes, you are at higher risk of developing type 2 DM later in life. Brittle diabetes. It is a form of type 1 diabetes that's marked by frequent and severe episodes of high and low blood sugar levels. Next is latent autoimmune diabetes in adults, LADA. Like type 1 diabetes, LADA also results from an autoimmune reaction. It develops slowly than type 1 diabetes. The name itself indicates it develops later in life, usually over the age of 30, whereas the type 1 develops in children and young adults. Next is maturity onset diabetes of young, MODY. It also called monogenic diabetes happens due to inherited genetic mutations that affects how your body makes and uses insulin. Do you know, this acts more like type 2 diabetes, but the difference is Moody effects at young age. Neonatal diabetes. Diabetes that occurs within the first 6 months of life. It also form of monogenic diabetes. About 50% of babies with a neonatal diabetes have the lifelong form called permanent neonatal diabetes mellitus. For other half, the condition disappears within a few months from onset, but it can come back later in life. This is called transient neonatal diabetes mellitus. The last one is drug-induced diabetes. Certain drugs may induce hyperglycemia through a variety of mechanisms. Usage of diuretics like thiazide, beta blockers, calcium channel blockers, and steroids can induce hyperglycemia. If this video really helps you, please like, share, and subscribe my channel. Thanks for watching.